Let me ask you some news about Obamacare, and some of this might make people angry, but according to the Associated Press, the Obama administration is about to spend almost $700 million on a national marketing campaign for Obamacare. Carl, $700 million to market. Now, under the theory that 16% of the American people are uninsured and you need to reach them and tell them about it, $700 million, really?
Yeah, look, realize this. Sure, there are a lot of people out there without health insurance, but they don't want all of them signing up. They're focused on getting 2.7 million people who are under the age of 35 signed up. Now, why is that important? It's important because under the new Obamacare law, the Affordable Care Act, younger, healthier workers will pay a higher premium than they would otherwise in order to subsidize the coverage for older, less healthy Americans. So what they've got to do in order to make the numbers work is they've got to go out and get 2.7 million young people to sign up so that they're paying in more money than they would otherwise, and then that makes the numbers look better as they start to sign up the less healthy older workers.
All right, I got an idea. It's not going to cost $700 million. If we only need 2.7 million of younger workers, I did a little math. President Obama, Kim Kardashian, Ashton Kutcher, and Oprah, if you take all their Twitter accounts, they reach 88 million people on Twitter. They can go tweet it out and say, tell 5 of your friends, and we reach almost 500 million people, more than the U.S. population. I realize not everybody's on Twitter, but go to the NFL, ask them for like 15 seconds of the first season game, and give it to it free. Maybe they'll probably do that. Probably NFL will do that for public service. Tell the churches, and then attach something. What? I got a lot of freeways. It's not going to cost $700 million.
Well, look, you're missing the point. Part of the point here is to reward his political allies. This is being run by veterans of his political campaign, and they're hiring community groups around the country, a.k.a. their political allies, and they're putting some money in their pockets. They're hiring community activists in the state of Texas. I think the number's over 100,000. In California, more than 100,000. Look, they're going to run a bunch of television ads. I wrote a column about this 2 weeks ago in the Wall Street Journal. They're buying a bunch of media markets, like they're buying New Orleans and Charlotte, North Carolina. They're not buying Los Angeles. They're not buying New York. They're not buying Chicago. They're not buying Boston. They're not buying San Francisco. They're not buying 6 of the 10 largest markets in America. But they're going to go buy TV ads to sing the praises of Obamacare in New Orleans and in Charlotte, North Carolina. What about those markets? Why those markets? Well, those are in battleground states with U.S. Senate races where the Democrat incumbent voted for Obamacare and is defending their vote. They're buying a bunch of markets in states with Republican governors who are up for election next year. They're not buying them in the biggest markets. They're not buying them in Los Angeles or New York, but they're buying them in places where it will have a political impact. The implementation of Obamacare, the $700 million, and watch it. By the time we're finished, it is going to be north of $1 billion. It could be north of $1.5 billion is being spent for advertising and political help in order to shore up the president's political base and reward his political allies. I mean, look, they were talking about how they're going to use the same micro-targeting techniques they used in the election run by the same guy to target their political allies and these young people to get them signed up to try and make the numbers work. And they're talking about signing up a number of people that is way less than the number that they promised would be signed up in the first year that the law was fully informed when they passed the bill back in 2010.
I just got to add 2 more things to my program because it's not going to cost a dime. You can put a sticker on the food stamps to tell people about it for the people who get food stamps, and you can ask the churches for help. And here, let me be a little sarcastic. Lois Lerner tonight, she's still on the government payroll. She's got nothing to do. Bring her in, let her use a phone bank. And the SEC lawyers who we pay, who download porn on the American taxpayers' dime, have those SEC lawyers who are downloading porn instead try to help notify people if that's so important. But that's me being sarcastic. I'll give you the last word.
Now, you are being sarcastic. Now, one other serious fact about this. Remember, next year they have taken the employer mandate and delayed it 1 year. That's because when the employer mandate comes into force, it will encourage a lot of small businesses to dump their employer-provided coverage. They didn't want to have that happen in election year. The other thing they're going to have to deal with is this, though. A lot of people who are going to be signing up for the Affordable Care Act, for Obamacare, for health insurance, are going to think that it's completely free. I would suspect most of the people who are their targets are thinking, well, this is going to be free for me. But everybody who signs up for the Affordable Care Act is going to have to pay a premium. And that premium could be over $1,000 a year. And what I think we're going to do is find a lot of people who say, wait a minute, I thought this was going to be free. Now that it's going to cost a lot of money out of my pocket that I can't afford, I'm not going to pick up the insurance. And that's going to be a problem.
Carl, as always, thank you.
You bet. Thank you, Greta.
And now to tonight's hot button issue on GretaWire.com. Do you think $700 million should be spent on marketing promotion for Obamacare? Go to GretaWire.com and vote in our poll right now. GretaWire.com, $700 million. Do you think that should be spent?